So Debbie, really nice to meet you and nice to connect with you. Thanks for joining on this kind of Q&A. What I'd love to know, just starting off the bat, is what you ended up working with Protera for. What were you dealing with from a pain perspective?
I was diagnosed with tendinitis in both of my biceps. So that kind of hurts. And I'm a real active person, particularly in the sport of pickleball. So it was affecting my play, or let's just put it this way, it's affecting my life that
Yeah.
I couldn't do what I wanted to do without causing pain.
Was this a new condition with the shoulders, or have you been dealing with this for a little bit?
Well, I experienced the same diagnosis and pain a year ago, May, and that was due to just overwork in the yard and pickleball and golf. Like I say, I'm pretty active and working out too much. So it wasn't new. However, last spring I did not seek physical therapy. So, and this time I did, and this time I have much better results and quicker results, and we had a plan, and we could talk about that.
Absolutely. And the physical therapy is I'm assuming you're referring to participating in the Protera program.
Correct. The protein,
Awesome.
yes.
And yeah, tell me about how your experience was with the program.
The program is phenomenal. That's why I would love to tell the story to anybody and everybody. First of all, it's super professional in that I met with a doctor first to make sure, everything is up and correct, and I could get the proper therapist to work with me and the proper protocol to work with me. So I call it very professional, and I call that the onboarding process was very thorough. And then being assigned to the proper therapist. It's very important to get the right personality and the right person. And my situation was a little unique because I'm a snowbird. And so this all occurred while I was in Arizona. So I was paired up with a therapist from your company that is a licensed therapist in Arizona, just to make everything legit and legal. So that was, again, that's where I go into the how professional you are. Um, then just going into the convenience of being Zoom based and web based and portal based is unbelievably convenient. I've had physical therapy, this is probably number 5, but with other companies, and always the traditional method of going to a brick and mortar place. So being at home and designating the time and the place with my therapist, your therapist, was awesome. And because it was always a one-on-one experience with a therapist, I just felt more special. I could get so much more attention. And then your portal and your website, which is then customized to me, everything that I needed to know, or that the therapist worked with me on, would be recorded, so I would then be able to go back and look at it if I had questions or concerns with all my exercises. And then the mere fact that also there's a chat box in your portal, in my personalized portal, where I could put a question at any time and day to my therapist, and she would respond in less than 24 hours with the answer of like how to adjust, or don't do that, or let's drop this exercise and let's try this one. So that goes into how convenient it is, how efficient it is, and the therapist being available 24/7. You just feel special.
Awesome. I'm glad that that was the experience that you had is by design. And I'm glad that you kind of appreciate that because that's how we designed it to be. So you get all that attention. Is this the first time you've tried a virtual program for joint pain?
Yes.
Awesome.
And I would highly recommend it to anybody in the future. I will say, though, you do have to be disciplined because you will only gain success and progress if you do what you're supposed to do and you have a method in your portal to document that every day, and that shows the therapist what you have or have not done. So you just have to be a disciplined person, but that's the only way you're going to achieve your goal. My goal was to get out of pain and then also to gain my strength back, all of which has been accomplished. As a matter of fact, I will be graduating from your program tomorrow, I believe, and
Wonderful.
super excited.
Were you surprised, or what was your initial thought on, like, did you think the virtual program would work, or were you pretty confident that it was going to work for you when you first started out?
I was skeptical because I just had never put myself through it. But I mean, I've done Zoom doctor's appointments and, those are successful. And so I said to myself, what do I have to lose? I had nothing to lose. You just give yourself, give it a try, put some effort into it. And I'm certainly very grateful and glad I did.
Yeah, no, I think you're absolutely correct because even with physical therapy in the office, brick and mortar, right? You still have to do a home exercise program. Your therapy will still run out. You still have to take ownership of that care journey like you did, and you still have to be disciplined to get that benefit, just like you would do if you're trying to do weight loss or any other,
Correct.
hypertension, blood pressure control. You still got to do your part, and I think that's exactly correct. Did you end up getting before you started the program or heard about the program? Did you get any X-rays or MRIs about the shoulders?
No, I did go to my primary physician a year ago, May, when I experienced this first exact pain. And I guess I must be very classical description of what was going on. And obviously my primary physician knows me pretty well and knows the history of some of my other physical therapy needs. It's always because of overwork or overexertion. So, no, to answer your long story answer to your short question, no, I did not have any X-rays to validate.
Yeah, and you know what most people don't actually know is that most orthopedic conditions, unless it's like a traumatic thing or something concerning, like we call them red flag signs, most time you don't need to jump to imaging right away. And so this is exactly why, because you can get better without having to get a bunch of tests or imaging. Do you think you need X-rays or MRIs now?
No, no, because I'm pretty much pain free.
Yeah.
Um, it's also taught me, or my therapist has taught me, modify some of the things you do. Don't lift so much. Don't play for 2 hours straight. Just do half a bucket full of dirt.
Yes, yes. Yeah. Yeah. And what was your experience kind of with some of the videos, the education videos? How did you like those videos, or how did what do you think about those videos that you got in your portal?
They were very helpful, and when um, I needed just a refresher of my mind. Am I doing this correctly? Should I be holding it this way? Or, yeah, it's just a refresher of proper form. And form is very important in all exercises, but specifically in your therapy. So, again, it's just a reiteration of the one on one you had with your therapist, but you could access it at any time.
Absolutely. And if you didn't hear about Protera, you didn't get, that message, what would you have done about the shoulder pain, you think?
I would have just done what I did last year, and which was rest it, which was very frustrating because I'm not a resting type of person. I much prefer the protocol I went through with Protera, is learning really what the root cause of the pain was, learning a whole lot new stretches because this is probably going to happen to me again. And then how to um, graduate from just stretching to strengthening. And that's where I am now.
Do you think you would have ended up getting X-rays or MRIs or injections if the pain kept coming back and you had not tried Protera?
I probably would have asked my primary physician that, or and insisted on it, but I don't know what they would have prescribed.
Yeah. What was your favorite part about the program?
Um, I just think the flexibility, the efficiency, and the convenience. And oh, by the way, I made significant progress in less than 2 months.
Awesome. David, that was the question I had. I mean, I'll ask one more other question. What do you want to see us improve upon, work on, or and make better on the program?
That's a pretty tough question because I highly recommend it. I mean, when I say it's professional, convenient, efficient, I assume it's cost efficient for you and the insurance companies. So, other than making this available for more people or you being expanding your business, that's all I can think of.
Yeah, no, that I mean, yeah, it is very cost effective because like you found out, you don't need to get a bunch of expensive tests and imaging if we can get you better. Of course, if it's something concerning, then you need to, then we get the imaging. But if we can get you started that program, that's how we save costs for everybody. Also for patients who have co-pays and deductibles too. One more question for you. Let's say hypothetically the program was only exercises but no physical therapy, professional or messaging or doctor's visit. Do you think it would have been as effective if it was mostly just focused on exercise, like on your portal?
Just exercise? No, there's way too many other online exercise programs. I mean, I don't know what would make yours special. You know what I
I
mean? Silver sneakers, there's, you know, all that kind of stuff. No, it's got to be a PT base. It's got to be therapy based and doctor based.
Debbie, I'm with you. I'm fully aligned with you on that one. So I agree with completely. I think that's also having the team-based approach and having that accountability, knowing that there's real humans that are helping, that are focusing on your health. We think that's the most effective way, and it doesn't mean you need 3 visits a week. A visit every week or every 2 weeks, and doing your own homework goes a long way. And I think that, yeah, I mean, I think you experienced what we're trying to do. This was awesome to get to know you and connect with you. We're here for you if anything ever comes up again. But I'm excited for you to get going on all your activities and pickleball and stay active. And I'm glad we could help you on that journey.